Hey guys, Rich DeSilva. Today is going to be my knee pathology video. Sorry, my hair looks ridiculous. I had a sweet scrub hat on all day, and it's getting a little sloppy. So we're going to go with the Jimmy Neutron, Johnny Bravo look today. So we have a couple of different things going on. First and foremost is the methods of injury to the knee. This is going to be anything that causes excessive rotational torque on the knee, as well as a direct blow anterior or posterior that's going to push the tibia anterior or posterior. The most common type is going to be a meniscal tear. People have these, they don't even know they have it. People will tear the meniscus, finish a baseball game, and then 2 days later it's swollen and crazy, and they're like, oh my god, what happened? Meniscal tear. You have pain, stiffness and swelling, catching or locking of the knee, loss of range of motion, especially if, say, part of the meniscus were to break off and lodge itself into the joint itself, the joint of the knee. This would seriously inhibit range of motion, depending on what part of the meniscus it came off. It would hurt a lot. Also, it would cause pain in the joint itself because you'd have seriously restricted range of motion because now you have this joint that requires all this cartilage and all of these ligaments to just stay together, and now you have a piece of meniscus just sitting in there. This is not a good thing for motion. Multiple types here. So you have technically 5 types. Let's call it really 3. So your 5 types are going to be longitudinal, bucket handle, radial, parrot beak, and transverse. I did have to look these up in a couple of different places. These are the 5 real common ones that I found. So your longitudinal is going to run, let's say you took your meniscus and you turned it from here and you flipped it so you can view it vertically. So here's your anterior, posterior, lateral, right? So your longitudinal is going to run on the outer lateral edge of the lateral edge. So that's your longitudinal. It runs lengthwise, let's call it up and down. You have your bucket handle, which is lengthwise like the longitudinal. However, instead of on the lateral edge, it's on the medial edge. So just kind of by the definition of it, it's usually smaller. It's on the inside, so there's really less surface area to work with. You have your radial. Your radial is going to be a tear that begins medially and runs laterally, so it's horizontal. And a parrot beak is going to be a radial tear that continues inwards and causes the tearing to become worse. And I kind of drew it out because I didn't really know how to explain this, but it leaves you a flap where it used to be here that tears up and looks like the beak of a parrot. My drawing is horrible, but this is the torn edge. So these used to be one piece. And last but not least is a transverse. Transverse, radial tear that has run straight across from avascular to vascular, medial to lateral. So really, radial, parrot beak, and transverse are kind of the same thing, different degrees of severity. Next you have your ACL. Your ACL is characteristic of a popping sound when it gets injured, severe pain and swelling, and instability. Because remember, the ACL, femur, tibia, your ACL keeps your knee joint and your tibia in particular from moving anterior with respect to the joint. So imagine now you don't have that ligament. As far as your PCL will let your knee move, it's going to flop out of this joint and not be stable. You have 4 types. Proximal, distal, middle, and combined. So proximal would be at the superior end where it articulates with the condyle. Distal at the base, the inferior end where it articulates with the tibial plateau. Middle and combined are kind of self-explanatory. Middle's in the middle. Combined is any combination of the other 3. Could be distal middle. Could be distal middle. It could be any combination. Finally, you have LCL and MCL tears. These are your lateral and medial collateral ligaments. This is going to be affecting your stability laterally and medially, so the pitch of your knee. That's what's going to be affected with the LCL and MCL. They're split into three types. Grade 1 sprain is going to be a stretch of the ligament characterized by pain that'll run along the ligament, the length of it. 2 is going to be a partial tear, mildly decreased stability. It's still together, so it's still there, holding, but it's weakened, shredded, stretched, injured. And grade 3 is going to be a complete tear. If it's torn apart, there's a significant loss of stability because you now don't have something holding your knee laterally, medially, or both. So this is going to be, similar to the others, a more serious event. So kind of to sum everything up, it's kind of a basic thing, especially without the repairs. In your meniscus, you have 5 possible types of tears. The way I see it, 3 really. You have your longitudinal, your bucket handle, and your radial. And then radial, you can have parabeak and transverse, which are more serious versions of the same. Your ACL, you have proximal, distal, middle, and combined, 4 total. And again, really 3 total, with a combination of the 3 being your 4th. And LCL and MCL, you have 3, grades 1, 2, and 3. I hope that summed it up for you guys. This one was actually a cool one, but watched a lot of weird, gross, knees getting injured videos, and so anyway, this one was short. The next one I would imagine is going to be my repair video, so I'll go back and be a little more extensive with it, talk about how to fix each type and all that. But for now, that is the knee pathology video, and looking forward to your feedback. Have a good weekend, guys.